Hello everyone, this is Dr. Sam, and today we will learn the difference between ultrasound, X-ray, CT, and MRI. We will have an overview of each modality and how they work, what are they best for, and what are their limitations. First, we start with ultrasound. Ultrasound is one of the safest and most widely used medical imaging techniques. It is completely radiation-free, fast, and incredibly versatile. But how does it actually work, and what is it best used for? Let's break it down. Ultrasound uses high-frequency sound waves far above what the human ear can hear. Here's how it works. A handheld device called a probe or transducer is placed on the skin with a layer of gel. The gel helps the sound waves travel smoothly into the body. The probe sends these sound waves into the tissues. As the waves hit different structures inside, like organs, fluid, or blood vessels, they bounce back as echoes. These returning echoes are captured by the same probe and sent to a computer. The computer then converts the echoes into a real-time image, allowing clinicians to watch what's happening inside the body as it actually happens. Here's what ultrasound is best for: soft tissues. Ultrasound is excellent for imaging soft organs like the liver, kidneys, thyroid, and muscles. Because sound waves travel well through soft tissue but not through bone or air, ultrasound is ideal for evaluating these areas. It is also best for pregnancy monitoring. One of the most well-known uses of ultrasound is monitoring pregnancies. It allows doctors to safely check the baby's development, measure growth, view the heartbeat, and examine the placenta and amniotic fluid without exposing the mother or baby to radiation. It is also very good for guiding injections and biopsies. Ultrasound provides a real-time roadmap for procedures. When doctors need to place a needle into a joint, around a nerve, or into a suspicious lump, ultrasound helps guide the needle precisely to the right spot. This improves accuracy and reduces risk. Doppler ultrasound is a special technique that shows movement, especially blood flow. It helps doctors see if blood is flowing normally through arteries and veins, detect blockages, or assess conditions like deep vein thrombosis or varicose veins. It can also measure the speed and direction of blood flow, making it valuable for diagnosing heart and vascular problems. We can get a real-time evaluation of blood flow in the vessels. Now we will look at why ultrasound is one of the most widely used and trusted medical imaging tools. There is no radiation usage. It is very safe. One of the biggest advantages of ultrasound is that it uses sound waves, not radiation. This makes it extremely safe for repeated use and suitable for patients of all ages, infants, children, and even in pregnancy. Because there's no ionizing radiation involved, there's no added risk of cell damage, making ultrasound the preferred choice when safety is a major concern. Ultrasound is portable and relatively inexpensive. Another major benefit is portability. Ultrasound machines can range from full-sized hospital units to compact handheld devices that fit in a pocket. This means doctors can use ultrasound almost anywhere. At the bedside, in emergency rooms, intensive care units, ambulances, and even in remote or low-resource settings. On top of that, ultrasound is significantly less expensive than other imaging technologies like CT or MRI, making it more accessible for both patients and healthcare systems. Ultrasound provides real-time imaging, which means it shows movement as it happens. This is incredibly useful for examining dynamic structures such as heart valves opening and closing, blood flowing through vessels, or a fetus moving during pregnancy. Because clinicians can see these processes live, ultrasound is ideal for guiding procedures like biopsies, injections, and catheter placements. While ultrasound is an incredibly useful and versatile imaging tool, it does have some important limitations. It is poor for viewing bones or air-filled organs. First, ultrasound does not image bones or air-filled organs well. Why? Because sound waves behave differently when they hit certain materials. Bone is very dense and reflects nearly all the sound waves back, which prevents the machine from seeing structures behind it. Air does the opposite. It scatters the sound waves in all directions. This makes organs like the lungs or intestines difficult to visualize. So, while ultrasound is excellent for soft tissues like muscles, organs, and blood flow, it's simply not the right tool for looking at bones or areas full of air. The second limitation is that ultrasound is highly operator dependent. This means the quality of the image, and even what's captured at all, depends heavily on the skill, experience, and technique of the person performing the exam. The technician needs to choose the correct angle, pressure, settings, and probe movement. A small change in positioning can dramatically improve or worsen the image. Because of this, two technicians can produce very different results, even using the same equipment. Finally, ultrasound has limited penetration depth, which can be a challenge in larger or obese patients. Sound waves lose strength as they travel through tissue. The more tissue they need to pass through, the weaker the returning echoes become, resulting in a blurry or incomplete image. This may make it harder for clinicians to see deeper structures clearly, such as organs in the abdomen. In these cases, other imaging methods like CT or MRI may be preferred. Now we look at X-rays. When you get an X-ray, a special machine sends out a form of energy called ionizing radiation. This radiation is made of high-energy waves that can pass through most parts of the body. But different tissues absorb this radiation differently. Soft tissues like skin, fat, and muscles let most of the X-ray beam pass through. Because they don't block much of the radiation, they show up on the image as darker shades of gray. Dense tissues, especially bone, behave differently. Bone contains calcium, which is very good at absorbing X-rays. Since it stops more of the radiation, less of the X-ray reaches the detector behind you. As a result, bones appear bright white on the final image. This difference in absorption is what creates the contrast you see in an X-ray picture. Darker areas represent tissues that allowed the X-rays to pass through easily, while bright areas represent structures that absorb the radiation. So, simply put, X-rays pass through the body, soft tissues let them through, dense tissues block them, and the image is created based on how much radiation each part absorbs. X-rays are the gold standard for looking at bones because they show the difference between dense structures and softer tissues very clearly. Bones absorb more of the X-ray beam, so they appear bright white on the image. This makes it easy to see fractures, from tiny hairline cracks to complete breaks, and dislocations when a bone slips out of its normal position in a joint. It is helpful in evaluating bone alignment and for assessing healing after treatment. It can also detect degenerative changes, such as arthritis or bone spurs. In short, if we're dealing with a suspected break or a joint injury, the first step is almost always an X-ray. X-rays are also extremely valuable for examining the chest, especially the lungs and heart. Pneumonia shows up as cloudy or white patches in the lungs, where air spaces fill with fluid or infection. An X-ray helps confirm the diagnosis and shows how extensive it is. Lung collapse, or pneumothorax, is another emergency situation where an X-ray is essential. A collapsed lung will appear darker than normal, and the edges of the lung may shift inward. This allows doctors to quickly identify the problem and start treatment. Chest X-rays are fast, widely available, and can be performed right at the bedside, which makes them vital in emergency medicine. Dentists rely heavily on X-rays because they reveal structures that can't be seen during a regular oral exam. Dental X-rays help identify cavities hidden between teeth, tooth root problems, bone loss from gum disease, impacted teeth, such as wisdom teeth, planning for braces, implants, or extractions. These images allow dentists to catch issues early, plan treatment accurately, and monitor your oral health over time. When it comes to medical imaging, X-rays are often the very first tool doctors reach for. Let's look at their advantages. X-rays are fast and widely available. One of the biggest strengths of X-rays is their speed. In most hospitals or clinics, an X-ray can be performed in just a few minutes. You walk in, the technologist positions you, the machine takes the image, and that's it. This speed is crucial in emergency situations, like when someone comes in with chest pain after an accident or a suspected broken bone. Plus, X-ray machines are everywhere. Hospitals, urgent care centers, dental clinics, even mobile units. So if imaging is needed quickly, the X-ray is almost always the fastest option. X-rays are good at detecting certain acute problems. They excel at spotting certain issues right away. They're especially good for bones, so fractures, dislocations, and bone infections show up clearly. They also work well for chest problems. Things like pneumonia, collapsed lungs, or heart enlargement can be seen on a standard chest X-ray. Because the images are produced so quickly, doctors can make fast decisions about treatment or whether more advanced imaging is needed. Another major advantage is cost. X-rays are one of the most affordable imaging methods. A single X-ray typically costs a fraction of what a CT scan or an MRI would cost. This makes them a practical first step when a doctor needs an initial look inside the body. If the X-ray suggests a more complicated issue, then more expensive tests like CT or MRI can be done afterward. In many cases, though, the X-ray gives enough information on its own and saves the patient both time and money. Like every medical tool, X-rays have limitations. The first one is radiation exposure, even if it's a low dose. X-rays work by using ionizing radiation, a type of energy powerful enough to pass through your body. Although a single X-ray delivers a very low dose, the exposure still adds up over time. For example, one chest X-ray is roughly equal to a few days' worth of natural background radiation, not dangerous by itself, but something doctors consider when deciding whether an X-ray is necessary, especially for children, pregnant patients, or people who need repeated imaging. The next limitation is limited soft tissue detail. X-rays are excellent at showing bones because bones absorb much more radiation and appear bright white. But soft tissues, like muscles, organs, and blood vessels, don't have as much contrast. They tend to blend together on the image. This means an X-ray might show that a bone is broken, but it won't clearly show things like ligament tears, early inflammation, small tumors, and organ abnormalities. For these details, doctors often turn to other imaging methods like ultrasound, CT, or MRI. An X-ray is basically a flat picture of a three-dimensional body. Everything in that beam path overlaps on top of each other. That means a small lung nodule can be hidden behind the ribs, a fracture may be missed if the bones overlap, subtle abnormalities can be concealed by surrounding tissues. This is one reason why doctors sometimes order multiple views, like front and side images. And if even more detail is needed, they might move to a CT scan, which creates a 3D view instead of a flat one. Now we will look at CT scans. CT scans, short for computed tomography, are one of the most powerful imaging tools in modern medicine. But how exactly do they create such detailed pictures of the inside of the human body? First, imagine a regular X-ray. It takes a single snapshot through the body, like shining a flashlight straight across a room and capturing only the shadows. Useful, but limited. Now, a CT scan takes this concept much further. Inside a CT scanner, there's a ring-shaped frame called a gantry. Within that gantry is a rotating X-ray tube. As the patient lies on the table slowly moves through the center of the machine. While this happens, the X-ray tube spins rapidly around the patient, sending out X-rays from many different angles. On the opposite side of the tube, detectors measure how much of the X-ray beam passes through the body at each angle. Every rotation produces cross-sectional slices, thin, layered images of the body, almost like cutting a loaf of bread into slices and examining each piece individually. But the real magic happens in the computer. After collecting hundreds or even thousands of these measurements, the computer uses complex mathematical algorithms to reconstruct the slices into detailed two-dimensional cross-sections. Then, it can stack those slices together to create a highly accurate three-dimensional view of organs, bones, blood vessels, or injuries. This is why CT scans are so helpful in emergencies. They quickly reveal internal bleeding, tumors, fractures, infections, and many other conditions with remarkable clarity. A CT scanner takes many X-rays from all around you, the computer processes them, and the result is a detailed 3D picture of what's happening inside your body. That's how CT scans turn rotating X-rays into life-saving insight. Now we will look at the main benefits of CT scans. One of the most important uses of CT scans is in emergency trauma care. If someone is in a car accident, a fall, or any major injury, CT scans help doctors immediately look for internal bleeding, broken bones, and damage to organs such as the liver, spleen, or kidneys. This speed and accuracy can be life-saving, allowing surgeons to act quickly if there's a medical emergency that can't be seen from the outside. CT scans are also essential in the detection and evaluation of tumors. They help show the size, shape, and exact location of a mass. Even more importantly, they play a major role in cancer staging, which means determining whether the cancer has spread to nearby tissues, lymph nodes, or other organs. This information helps doctors choose the best treatment: surgery, chemotherapy, radiation, or a combination. CT scans are a first-line tool in diagnosing blood clots, especially in the lungs, a condition called pulmonary embolism or the major blood vessels. In stroke cases, a CT scan is often done immediately because it can quickly show whether the stroke is caused by bleeding in the brain or a blocked blood vessel. This difference is critical because each type of stroke requires very different treatment. CT scans provide highly detailed images of the lungs, making them excellent for identifying infections, chronic lung disease, or small nodules that may not be visible on a simple X-ray. They're also extremely useful for abdominal imaging, giving clear views of organs like the liver, pancreas, kidneys, and intestines. This makes CT scans helpful for diagnosing conditions such as appendicitis, bowel obstructions, kidney stones, and other abdominal emergencies. CT scans give much more detail than regular X-rays. Bones, organs, blood vessels, and soft tissues can be seen with incredible clarity. This is especially useful for detecting subtle injuries or small tumors that a traditional X-ray might miss. CT scans are fast. In emergency situations, like trauma or suspected internal bleeding, doctors need rapid answers. A CT scan can often be completed in just a few minutes, allowing medical teams to make critical decisions quickly. And finally, CT scans allow for 3D reconstructions, giving surgeons and specialists a comprehensive view of complex anatomy. These 3D images help in planning surgeries, guiding interventions, and understanding exactly where problems lie in relation to surrounding structures. While CT scans are incredibly valuable for diagnosing a wide range of conditions, it's important to understand their limitations. They have higher radiation dose. CT scans use X-rays to create detailed 3D images of the body. Because multiple X-ray images are taken from different angles, the total radiation dose is significantly higher than that of a standard X-ray. While the risk for most adults is low, repeated exposure should be minimized whenever possible. They are not ideal for young children or frequent screening. Children are more sensitive to radiation than adults, so doctors usually avoid CT scans unless absolutely necessary. Similarly, for people who require frequent imaging, alternatives like ultrasound or MRI might be considered to reduce cumulative radiation exposure. There may be contrast dye risks. Sometimes a contrast dye is used to improve image clarity. In most cases, cases, this dye is safe, but in rare situations, it can cause allergic reactions or affect kidney function, especially in patients with pre-existing kidney problems. Medical teams always screen patients carefully before administering contrast. Magnetic resonance. Imaging, or MRI, is another one of the powerful tools in medical imaging today. Unlike X-rays or CT scans, MRI does not use ionizing radiation. Instead, it relies on the physics of magnets and radio waves to create incredibly detailed pictures of the body's internal structures. Your body is mostly water. Water molecules contain hydrogen atoms, and hydrogen atoms have protons that act like tiny magnets. When you enter the MRI scanner, a strong magnetic field aligns these hydrogen protons in your body in the same direction. Next, the machine sends in radio frequency pulses, which briefly knock these protons out of alignment. When the pulses stop, the protons relax back to their original positions. As they do, they emit tiny signals. These signals are detected by the MRI sensors and processed by a computer. The computer uses these signals to generate detailed images of the body's tissues. Because different tissues, like fat, muscle, or brain matter, have different hydrogen content and relaxation properties, the MRI can distinguish soft tissues with incredible clarity. This is why MRI is particularly useful for imaging the brain, spinal cord, muscles, joints, and internal organs, revealing details that X-rays or CT scans might miss. And because MRI uses magnets and radio waves, it is safe for repeated use without the risks associated with radiation exposure. In short, MRI turns the water in your body into a map, allowing doctors to see the intricate details of soft tissues and detect abnormalities early and accurately. MRI is best suited for imaging the brain and spinal cord. This makes it invaluable for diagnosing neurological conditions such as multiple sclerosis, tumors, stroke, or spinal cord injuries. It's also excellent for looking at soft tissues, including muscles, ligaments, and nerves. This makes MRI the go-to choice when doctors need to see injuries that X-rays or CT scans can't pick up. For joint injuries or tendon tears, such as in the knee, shoulder, or ankle, MRI provides a detailed view that helps doctors plan treatment, whether that's physical therapy or surgery. MRI is also widely used for detecting and monitoring tumors and neurological disorders, giving doctors a clear picture of size, location, and impact on surrounding tissues. Lastly, MRI can assess heart and pelvic organs, offering detailed imaging of the heart muscle, valves, and reproductive organs without any radiation exposure. MRI offers superior soft tissue detail. Unlike X-rays or CT scans, which are excellent for bones, MRI can capture fine structures like muscles, ligaments, nerves, and the brain's intricate anatomy. This makes it invaluable for diagnosing conditions like ligament tears, brain tumors, or spinal cord injuries. Second, MRI is completely safe in terms of radiation exposure. Instead of X-rays, it uses a strong magnetic field and radio waves to generate images. That means patients, including children and pregnant individuals, can often undergo MRI safely without the risks associated with ionizing radiation. MRI can produce multiple sequences, which are different imaging settings that highlight various tissues or abnormalities. Some sequences emphasize water content, others fat, and some are designed to reveal pathology like inflammation or tumors. This versatility allows doctors to see the body from multiple perspectives without additional scans. MRI does have some important limitations that patients and clinicians need to be aware of. MRIs are generally slow and expensive. A typical scan can take anywhere from 15 minutes to over an hour, depending on the area being scanned and the level of detail required. This makes MRI less practical for emergency situations compared to faster imaging methods like CT scans. Additionally, MRI machines and maintenance are costly, which can make scans expensive for patients or healthcare systems. MRI scanners can be noisy and sometimes claustrophobic. The machine generates loud tapping or banging sounds during the imaging process, which can be uncomfortable. Also, because patients lie inside a narrow tube, some people experience claustrophobia. Open MRI machines exist, but they often have lower image quality. MRI is not safe for everyone. Strong magnetic fields interact with metal, so patients with certain metal implants, pacemakers, or metal fragments may not be able to undergo an MRI safely. The magnetic field can move or heat metal objects, posing serious risks. Thank you so much for watching. Stay tuned for more imaging videos.